Ready for medical career growth? Yes, you are in the right place. Hello, this is Dr. Neema Bisht, BDS by degree and a pharma professional. As a founder of CareerInPharma, our mission is to guide medical professionals towards remarkable success in the pharma industry. With a track record of over 700 plus students trained and placed into various premier pharma companies, we are here to elevate your journey. Hello everyone, once again I welcome you all to CareerInPharma. Now in today's video, we are going to talk about what exactly is WHO UMC. Now this is another episode of our important interview question answers for pharmacovigilance. Now you must have heard a lot about WHO UMC in pharmacovigilance. There are many things which WHO UMC has provided in the field of pharmacovigilance. They have signal management centers, they have collaboration centers, they are international drug monitoring centers, and also they have drug dictionaries. We call it as WHO drug dictionary. They also have WHO UMC causality assessment scales. So what all things WHO UMC has done in pharmacovigilance field, and also what exactly WHO UMC, when we say WHO UMC, WHO UMC, yes. So we'll understand this from today's video. And also I get a lot of comments where in one of our video where we demonstrated how, if anyone is interested in going on a free self-paced program on pharmacovigilance, how they can do, because WHO UMC also has the same. So as that video which we uploaded earlier is not a latest video, so there are many things changed in WHO UMC website. That also we are going to show you from today's video. I'm going to demonstrate so that your query can be clear. Yes, so let's start. What is WHO UMC? I'm expecting that you all know what is the full form of WHO, right? Everyone knows. It's a World Health Organization. And what is UMC? UMC is a Uppsala Monitoring Centre. Okay, so what they monitor? They monitor adverse events internationally, globally. Yes, and Uppsala is a name of a place which is in Sweden. Yes. So WHO and UMC has come together in this collaboration where they are monitoring the adverse event internationally. Globally means all the countries across the world, they are sending their adverse event reports, analysis, everything to WHO UMC. And at WHO UMC, they are doing data analytics, data mining of this big data, and where they are generating new signal, new update. Okay, that's how it works. Now, what actually is, before I tell you what is WHO UMC, let's understand what is, WHO Program of International Drug Monitoring. So in 1968, WHO created a program which is known as WHO Program of International Drug Monitoring. Why this program is created? To ensure that the evidence about harm to patient was collected from as many sources as possible. So they started it internationally so that more and more reports can come. Because guys, to make analysis out of any data, definitely that data should be sufficient. In a small data we can't conclude, right? So that's why they ensure this program, this WHO program for international drug monitoring, ensures that the evidence whatever is coming about the harm to the patient was collected from as many sources as possible. And this enables individual countries, whosoever is part of WHO UMC International Drug Monitoring Program, these individual countries to be alerted to be patterns of the harm emerging across the world. Yes, so which might not be evident from their local data, right? If WHO UMC is taking their local data, from that it can't be evident. We need more data, big data, right? That's why all the countries are participating in this, and whenever any new update is there, WHO UMC coming back with the update through newsletter, through internets, and through many awareness programs. So UMC has been responsible for the operational aspects of this WHO International Drug Monitoring Program since 1978. So in 1968, WHO started this program of international drug monitoring, where UMC joined WHO in 1978 for the operational aspects. So operational means where database is required, they are collecting the data, they are doing the data mining. So whatever operations is required, that UMC is doing since 1978 in with collaboration with WHO. Yes. So Uppsala Monitoring Centre is for more than 40 years now and have provided scientific advancement and operational support to the WHO program of international drug monitoring. So UMC is like a forefront of medicine safety. Yes. Now Uppsala Monitoring Centre advances the science of pharmacovigilance and supports medicine and patient safety initiatives all over the world. Because whatever data is coming to the Uppsala Monitoring Centre is a global data. They are taking data internationally. They are accepting data internationally. And UMC is a self-funded body. It's a mission-driven non-profit foundation. Self-funded non-profit foundation and a mission-driven organization this is, which works with WHO and engage stakeholders throughout the global pharmacovigilance community. Yes. So this is little intro about WHO UMC. Now let's understand what is the UMC vision and mission. So as an international research and development organization with the important WHO mission to coordinate a global network of medicines regulatory agencies, and their vision is safer use of medicines and vaccines for everyone, everywhere. So their vision is to have a safe use of medicines and vaccines worldwide. So that is their vision. And what about the governance and funding of UMC, which I already told you? UMC is a self-funded body, non-profit organization founded by WHO and Swedish government in 1970. So in 1968, WHO created this international program for drug monitoring. Now UMC collaborated with WHO in 1970. To this day, the board members are appointed by WHO and the Swedish government. Now let's understand what exactly they do. Like I already mentioned, they are international body for drug monitoring across the world, globally, worldwide. But what exactly they do? Let me mention few points to you. So with an ultimate goal of influencing the lives and safety of patients for their betterment, now and in the future, they carry out pharmacovigilance research, develop products, and nurture collaborations with medicine safety stakeholders across the world. Now, what are these medicine safety stakeholders? These are regulatory authorities, these are pharmaceutical companies, biopharmaceutical companies, different CRO. Yes, so these are like stakeholder for WHO UMC. Another thing they're doing are they are maintaining the VigiBase. So till now, I assuming that you already know VigiBase, which is the largest pharmacovigilance database in this world, which is maintained and created by WHO UMC only. So VigiBase is the WHO global database of adverse event reports of medicines and vaccines, which grows by a few million reports annually, and now it's holding more than 35 million reports. So the insights that they and their partners get from this data enable them to identify potential risks and prevent unnecessary harm to the patients taking medicines. Another thing they do is they also provide WHO Drug Global. Like I said, there is a dictionary, drug dictionary called WHO Drug Dictionary, which is by WHO. So they also provide WHO Drug Global Dictionaries, which is used by pharmaceutical industries and researchers for coding and managing information on drug medicinal products. And they produce cutting-edge tools and analytical methods in the area of patients. So this is about the WHO UMC, how it started, what is the UMC, when UMC joined WHO, what is their mission and vision, what actually they do, what kind of body this UMC is, where UMC is. So this is all about WHO UMC. Now I want to share my screen so that I can show you very important thing about which I already mentioned about WHO UMC website. I just want to take you through this because we get a lot of queries regarding this program, the self-paced course which they have. And many times I think people are not able to understand how to do. Okay, so to get this website, you can simply type WHO UMC. Yes, now you can see already this their website has popped up, that is Uppsala Monitoring Centre. Okay, now I'm going to open it. I just want to take you through their website, okay, so that you can understand what exactly they do, and if you want to do their self-paced program, how you can do, what is the criteria. And let me tell you, it's free of cost. Definitely they have products which are which have charges, but yeah, that also have some criteria. So without getting certificate also you can do their self-paced program. Okay, now many times people ask me, oh, okay, what is the point if you don't get the certificate. Now let me tell you, any certificate, degree or diploma, I would say it's just a piece of paper. If you don't have good knowledge about anything, then definitely it's just a formality. Okay, so please don't do any courses or anything in your life which is just a formality. Please do it with your full heart and try to understand the concepts. Even if you don't do this self-paced program of WHO UMC, what they have, let me tell you, you will get a very good knowledge on, definitely on the basics, just scrolling their website. Yes, but yeah, if you want to take program, that also you can do that. I'm going to mention how you can. Yes, and they are self-paced. There are some high programs also for which there are certain criteria which not necessary that you meet that criteria. Okay, so this is the website. You can understand from here who we are. Yes, so you can read more about Uppsala Monitoring Centre. You can know more about WHO Program for International Drug Monitoring. Career means they have job openings also. Yes, so you can join them also. Yeah. Now let's understand what we do. So you can see they are into research, they are into signal work, they are into education training, they are into pharmacovigilance communication, means whenever any new safety alert is there, they are going to communicate it across the world with healthcare professionals, their stakeholders. They have publications library, they have newsletters. Yes, their products. Now these are their products, okay, which are there for companies, for organizations if they want to purchase. These are the solutions which WHO UMC is providing. They have WHO drug news, they have WHO drug subscription, which definitely big companies they do purchase. WHO drug portfolio, they have VigiBase services, customized VigiBase. So all these are their products. Yes, now let's come to what we do, because here you can find this education and training. So if you want to do their self-paced program free of cost, you have to go from here. What we do, then you go to education and training. Yes. Now in education and training, you can see they have mentioned everything. So here they have self-paced learning. Now there they have mentioned that these online courses are primarily for national and regional pharmacovigilance center staff. Now what does this mean, national and regional pharmacovigilance center staff? So if you are, let's say in India, if you are working in some national coordination center, so under the PVPI program, that is Pharmacovigilance Program of India, we have national monitoring centers, adverse event report monitoring centers, that we call it as AMCs. So if you are working in adverse event report monitoring centers, or if you are working in NCC, that is national coordination centers, or you are in CDSTO, if you are in these kind of stuff, definitely you can enroll yourself. Yes, but they are saying that these online courses are available for pharmacovigilance staff, also available to those who work in pharmacovigilance in public sector. So for public sector and university students. So I can understand that without any job, you can't be in any sector, right? So you can enroll to their program as a university student. You can always give reference of your university name, your university mail ID, and through that you will be able to do their self-paced program. Yes, So you can learn more about their self-paced program, how to take it. Yes, you can see they have so many things. Yeah. Now if I go back, you can see they have instructor-led online courses also. So put theory into practice with expert tuition in case series. I don't think so. This instructor-led online is for everyone, but still let's explore what it is. Yes. See, even if you don't go inside, I mean in detail, see here they have mentioned that national and regional pharmacovigilance center staff have priority on our courses. So if you can't have access, if you can't access any of the self-paced courses or our learning platform, write to us at support at the. So let's say if you are not a national and regional PV staff, and let's say you are a student, academia, and you are not able to enroll yourself, you can always write to them at support at whoumc.org, right? And let me tell you, they are very quick in their reply. Let me tell you this thing. Similarly, if you want to learn about medication error, so many things they have. So many things they have. Okay, so see, if I see they have mentioned the medication error. Now this is the course date and deadline. Yeah, so see, it is free of charge. Okay, so basically they give priority to people who are in some national pharmacovigilance centers, definitely. But if you are in public sector or academia, you can always write them that you also want program to learn the things. Yes, so let's see if I do apply here what it's showing. Let's see. So form is not currently accepting response. It means they already have, I mean maybe seats are full, right? So now let's go to their self-paced. So let's pick some self-paced program. Let's see what it's saying. Okay, so if I do learn more, okay, so here see, these are the basics. So here introductory course in pharmacovigilance, you can see all the details are there, right? Clinical aspects of pharmacovigilance, so many things are there to learn. Now the thing is, let's see, let's say if you want to work, so if you work at a pharmacovigilance center and wish to enroll, you contact us here. Okay, fine. So let's see their learning platform, what they are saying. Yes, so many things they have. Learn with UMC. Let's see what it is. Okay, so they have different programs. So available to public sector. So where it's available to public sector, they have mentioned. So let's see what is there here. Yes, so many things they have. See, introduction to pharmacovigilance. If I click on this, so they are saying, so one, attention is there. Course certificate will only be awarded to professionals working in national or regional pharmacovigilance centers. So they are not saying that you will not be able to do the program. They are saying we will not be able to provide you certificate if you are not a part of national or regional pharmacovigilance center. So no worries. Still you can learn their program because their program is so easy to understand, so crisp and concise. I really loved their program when I did back 5 years back. So you can just explore how you can do it. So from here you can enroll. Okay, while enrolling, if you don't have account, please create an account. If you already have an account, just see the forget option. Okay, now I have also got query from our community members, viewers, that many times they see a pop-up saying that your account has been archived. So please see this frequently asked questions from WHO UMC where they have mentioned that if your account is archived, then what should you do? Can you see? Please contact us. Do not create a new account if your account has been archived. Okay, so in that case, please contact them. From here you can write them a mail so that they can reactivate your. Yes, so and see, they have provided the recommendation also, what specific order you should follow, because without knowing what is pharmacovigilance, how you will understand what is ADR, what is signal. So crisp and clear they have mentioned the order as well. You should be taking Introduction to pharmacovigilance first, then ADR, then management system, introduction to signal detection, so many things they have given. Yes, so again they are mentioning people who are employed at national lab regional pharmacovigilance center, they are only will be awarded certificate. But yes, without getting certificate also you can enroll for this program, which is very easy to learn, self-paced, and there is no complexity. Trust me guys, if you're really looking for free programs without getting any certificate in the form of soft copy or hard copy, definitely you should go for WHO UMC. Trust me guys, you will get end-to-end information here, okay, especially if you're looking for free courses, and you can write them back for more support also. Yes, so with this, I'm going to conclude this video. I hope you got a clear-cut idea on what is WHO UMC, what they do, how they do, their vision, mission, and how you can enroll for their programs. Please explore their website properly. They have all the answers in their website itself. Yes, before you write to us, please check out their website, explore it properly. Yes, so this is all about WHO UMC. I hope you got clear-cut idea on what is WHO UMC, how it works, how they collaborated, why they collaborated, and so many steps. Yes, but still, if you have any doubt on their self-paced program, how it works, and anything, please comment below in our comment box, and we would love to read each and every comment, and would love to read and would love to reply each and every comment also. Yes. With this, I'm going to conclude this video, and will be coming soon with some fresh next video. Till the time I come again, till that time, please stay safe, aware, healthy, updated. And please don't forget to hit a like button. Don't forget to subscribe to our channel, and don't forget to share this channel to your friends who are preparing for it. Yes, so that's all about this video. Have a nice day. Bye-bye.